You're brushing your teeth late at night when it hits, a dull, nagging ache spreading across the small of your back. It isn't the sharp stab you get from twisting wrong. It's deeper, heavier, as if someone slipped a warm stone beneath your ribs and left it there to smolder. You stretch, twist, squat, and stand tall. Nothing changes. And that's when the thought flashes through your mind like a red siren. Could this be my kidneys? If you've ever felt that jolt of panic, you are far from alone. Every day, millions of people search the internet for phrases like kidney pain versus back pain, kidney's location, or right side back pain, kidney, desperate for reassurance that the ache in their flank isn't a warning drum of infection or failure. And even though most episodes of low back soreness come from muscles, discs, or irritated spinal joints, we can't help imagining the worst. Your kidneys, after all, filter every drop of blood in your body. They're buried deep, protected by bone, and when they're in trouble, the consequences can be severe. Hospital trips for antibiotics, dialysis, even transplant. That fear makes sense. Our brains are hardwired to treat any threat to vital organs as priority number one. Show a crowd an image of a stubbed toe and they'll wince. Show them a diseased liver or kidney and they'll recoil. We instinctively understand that pain near an internal organ can mean more than a pulled muscle. It could be life-altering. So when an ache lands near the back of your ribs, logic takes a back seat and, worst case, scenarios grab the wheel. But here's the twist almost nobody explains well. Musculoskeletal back pain and kidney pain rarely feel the same once you know what to look for. They come from different tissues, travel along different nerve pathways, and respond to movement in strikingly different ways. Yet the overlap on your body's map, the zone between the lower ribs and the top of your hips, creates a shadowy gray area perfect for confusion. That gray area fuels anxiety, late-night Googling, and sometimes unnecessary ER visits. Imagine two neighbors living on the same street. One is noisy every weekend, your muscles and joints. The other almost never makes a sound, your kidneys. When a new noise echoes through the neighborhood at 2 a.m., you don't know which house it came from, only that it's worrying and you want it to stop. That is exactly how your nervous system reports pain from that mid-back region. Something on Kidney Street is acting up, figure it out. So you poke and prod. You press your fingertips into the ache. You bend forward, side to side. You lie on the floor, hoping gravity will tell you something. Sometimes the pain fades after a warm shower, or returns the next time you unload groceries from the car. Sometimes it sticks around no matter what you do, making you replay every medical drama you've ever watched. If you're like most people, two voices begin to argue in your head. Voice number one: relax. It's probably just your lower back muscles. You did sit at the computer all afternoon. Voice number two: yeah, but what if it isn't? What if your kidneys are failing and you're ignoring it? Remember that article about silent kidney infections? Back and forth they go, each side recruiting Google articles, forum comments, and half-remembered advice from relatives as evidence. Meanwhile, the ache comes on, offering no clues. You promise yourself you'll schedule an appointment. Tomorrow, next week, eventually. But for now, you just want relief and certainty. That uncertainty is exactly what this video aims to end. Over the next few minutes, you'll learn how to decode the body's signals like a bilingual translator. One language for spinal and muscular complaints, another for renal distress. You'll discover simple movement tests that whisper, see, it's mechanical, not visceral, or, in rare cases, wave red flags that say, time to call a doctor. You'll understand why posture changes often calm one type of pain, yet leave the other untouched, why urinary symptoms matter, and why fever plus flank pain is never something to sleep on. But let's pause for a moment of honesty. Fear clouds judgment. When we're afraid, we catastrophize. A stiff back after gardening turns into, I might be in renal failure before dinner. The antidote to catastrophizing is knowledge. No, not random scrolling at 1 a.m., but structured, evidence-based knowledge delivered step by step. That's what you're here for, and that's what we'll provide. So take a breath. Feel your feet on the floor. Acknowledge the ache without judgment. Then listen closely, because the difference between musculoskeletal back pain and kidney pain is often as clear as a ringing bell. Once someone hands you the bell, by the end of this video you'll know. Why musculoskeletal pain usually changes with movement or position, while kidney pain doesn't care whether you sit, stand, or lie down. How the location of the ache, high under the ribs versus low across the belt line, provides a crucial geographic hint, which other symptoms, think fever, nausea, changes in urine, escalate mild concern to get checked today. And finally, which simple home remedies soothe mechanical back pain, and which warning should send you to a healthcare professional without delay. If you've ever whispered, "Could it be my kidneys?" We've got you. Stick around for part 2, where we break down the classic fingerprints of ordinary lower back pain, how it starts, what makes it flare, and why your favorite chair both helps and hurts. After that, part 3 shines a spotlight on genuine kidney pain. The deeper, steadier ache, the systemic clues, the red flags. And part 4 ties it all together with actionable checkpoints and clear advice on when to relax, when to self-treat, and when to pick up the phone. Knowledge dispels fear. Let's shine the light together, starting right now. Part 2, decoding ordinary lower back pain. Picture the architecture of your low back. 5 hefty lumbar vertebrae stacked like dinner plates, each one cushioned by a jelly-filled disc. Dozens of small facet joints acting as hinges, layers of muscles, ligaments, tendons, and fascia crossing in a crisscross pattern strong enough to hoist a refrigerator, yet sensitive enough to complain if you sneeze the wrong way. When something inside that mechanical maze misfires, the pain it produces has a signature feel. Learn the signature, and you're halfway to ruling out your kidneys. 1. The posture-dependent tell. Musculoskeletal pain is a drama queen. It changes its mood with every position you try. Bend forward to tie your shoes, and maybe it spikes. Arch backward over the arm of the sofa, and it melts. Twist to grab a seatbelt, and it bites again. That variability matters. Your kidneys sit deep, protected by ribs and thick muscle. Bending, twisting, or arching barely budges them. So if the ache rises or falls when you move, think spine, not kidneys. Try this micro test right now. Stand tall, slip your hands behind your back, and gently lean backward. Do you feel a pinch or a sharp catch? Now bend forward, letting your arms dangle. Does the pain shift or retreat? Most disc or facet problems howl in extension and sigh in flexion. Kidneys? They barely notice. 2. The familiar trigger list. Musculoskeletal back pain loves certain setups. Hours of sitting. Long drives or marathon work sessions glue your hip flexors short and jam your facet joints. When you finally stand, your spine screams until it rehydrates. Lifting awkwardly. Groceries, toddlers, the "I'll just move this couch a few inches" mistake. One wrong hinge and tiny stabilizer muscle spasm. Weekend warrior syndrome. You're desk-bound all week, then shovel mulch or swing kettlebells on Saturday. Muscles and discs that have been napping all week revolt. Poor sleep posture. A sagging mattress lets your hips sink, arching your lower back for 8 straight hours. Notice what's missing. Fevers, chills, cloudy urine, nausea. Your spine can't give you a fever. It just groans when you mistreat it. 3. The pain quality. People describe mechanical back pain with words like stiff, sore, tight, throbbing, stabbing, pinching. It may shoot into the buttocks or thigh, follow a nerve path, even cause a brief electric shock down the leg if a disc bulge brushes a nerve root. Kidney pain is different, deeper, duller, more of a constant pressure under the ribs, sometimes radiating into the abdomen or groin, but rarely tracing a nerve line. Close your eyes and grade your ache. Does it feel like a muscle you could massage, or a dull fist inside your flank that no position touches? If rubbing the area or applying a heat pad brings relief, odds favor muscles, not kidneys. 4. The morning ritual. A classic sign of mechanical trouble is a rusty robot sunrise routine. You wake stiff, hobble to the bathroom, maybe brace yourself on the sink. After 10 or 15 minutes of gentle movement and a warm shower, the spine loosens and you feel mostly human. That's discs reabsorbing fluid, fascia warming, muscles leaving nighttime spasm mode. Kidney pain ignores circadian rhythm. It's just there, dawn or dusk. 5. Movement medicine. Do this experiment. Lie on your back and pull both knees to your chest, rocking side to side. Most facet or disc aches ease in that fetal curl because gapping the joints and relaxing the paraspinals takes pressure off irritated tissue. Now drop your knees to one side in a gentle lumbar twist. Often you'll coax a satisfying release. Kidney-based discomfort seldom changes. If anything, deep twisting can make it throb more because you're tugging on the renal fascia. 6. The recovery curve. Mechanical injuries thrive on the Goldilocks zone of activity. Too much rest and they stiffen, too much load and they flare. But just the right blend of walking, core activation, and strategic stretching, and they improve day by day. Most people notice incremental wins. Able to sit longer, tie shoes without wincing, walk the dog a block farther. Kidney infections or stones tend to do the opposite. They either plateau stubbornly or worsen until treated. 7 red herrings that trick people. Sometimes a minor disc bulge refers pain upward toward the flank, exactly where a kidney sits. Sometimes a tight quadratus lumborum muscle creates an ache beneath the ribs. Those mimic kidney pain. So while they send people to urgent care, yet even then posture and movement still modulate the intensity. Stand with weight on one leg and the ache flares. Sit on an ice pack and it calms. Internal organ pain is far less obedient to posture. 8. When mechanical doesn't mean minor. Calling it ordinary back pain doesn't mean it's trivial. Bulging discs, stress fractures, facet arthropathy. They can disable careers and steal sleep for months. Mechanical issues can inflame nerves, trigger muscle guarding, even mimic sciatica. They deserve attention. Core strengthening, posture retraining, load management, sometimes imaging and professional therapy. But they rarely require 4 antibiotics or emergency surgery the way a raging kidney infection or a large obstructing stone might. Understanding that difference reduces panic and lets you focus on effective rehab instead of terrifying diagnoses. 9. Putting it all together. So if you're mapping the mystery ache in your lower back, start with these questions. Does changing position change the pain? Does it respond to heat, gentle stretching, or massage? Does activity alternately irritate and then ease it as the day warms up? Are you missing systemic signs, fever, chills, urinary changes that would warn of kidney trouble? If the answers line up with movement-dependent pain and absence of systemic symptoms, odds are overwhelming you're dealing with a musculoskeletal issue. That's not a dismissal. It's a roadmap. Mechanical problems have mechanical solutions. Ones we'll dig into in future videos on stretching, decompression, and strengthening. But for now, celebrate clarity. If your pain comes and goes with posture, if a warm shower helps, if walking loosens rather than intensifies it, you can almost certainly stop picturing dialysis machines and start picturing foam rollers and hydration. The next time fear whispers kidneys, you'll have a checklist to whisper back. Stay tuned for part 3, where we flip the lens and examine genuine kidney pain, the unrelenting ache, the red flag symptoms, and exactly when to quit Googling and call your doctor. Knowledge is power, and your peace of mind starts with knowing what your body is really telling you. Part 3. Recognizing true kidney pain and the red flag symptoms. Imagine placing your hands on your waist, sliding your thumbs upward until they nestle just beneath the lowest ribs. Hidden under those ribs, tucked deep against the back wall of your abdomen, sit your kidneys, each about the size of a clenched fist, filtering 50 gallons of blood every single day. Because they work silently, most people never give them a thought until one or both decide to protest. When that protest erupts, the pain is unlike the fickle, posture-driven grumble of strained muscles. It is deeper, steadier, and utterly indifferent to whether you stretch, sit, or lie perfectly still. 1. The signature feel of kidney pain. True kidney pain is a visceral ache. Patients often describe it as a dull, tight pressure high in the flank, just under the ribs, several inches above the belt line. It may radiate forward into the abdomen or down toward the groin along the ureter, but almost never shoots along the buttock or thigh the way a pinched spinal nerve does. Bend, twist, or arch and the ache barely budges. Sometimes movement jars it more, sometimes less, yet its core intensity remains stubbornly constant, like a stone lodged beneath the surface. 2. Indifference to posture. A kidney inflamed by infection or stretched by swelling does not care whether you're hunched over a sink or standing at military attention. Whereas mechanical back pain hisses when you arch backward and sighs when you curl forward, renal pain rides inside you like cargo. Change the angle of your spine all you like. The organ is still distended, still throbbing against its capsule. That unresponsiveness to position is your first big clue. 3. Systemic clues your spine can't fake. The kidneys are organs, not joints. When they're sick, the whole body often feels it. Think of these as a constellation of red lights on your dashboard. Fever or chills. Pyelonephritis, a kidney infection, floods your bloodstream with bacteria and inflammatory chemicals. Your temperature climbs, you shiver or sweat, you feel flu-like malaise that no pulled muscle can generate. Nausea or vomiting. The kidneys share nerve pathways with the gut. When they hurt, the stomach often rebels. If flank pain comes with waves of queasiness, pay attention. Urinary changes. Cloudy urine, blood-tinged urine, foul smell, burning during urination, or needing to go every 10 minutes with only dribbles. These are bright neon signs flashing renal. Muscles and discs don't change your pee. Radiating pain to groin or testicles in men. Labia in women. A kidney stone small as a grain of sand can send dagger-like streaks downward as it scrapes the ureter. Patient's pace cannot get comfortable, feel panic. Sudden severe pain after dehydration. Stones and infections love concentrated urine. A day of hard labor in the sun or a bout of stomach flu can tip the balance. 4. The stone story. Kidney stones deserve their own spotlight. Picture minerals slowly crystallizing inside the kidneys, collecting ducts until a shard breaks free. Instantly, the body screams. The pain is often described as worse than childbirth, sharp, colicky waves that come and go as the ureter spasms around the intruder. Unlike muscular pain that may ease with pressure, stone pain drives people to constant movement. They pace curl, uncurl, gasp. Nothing positions the stone more kindly. It hurts until it moves on, or is removed. Yet even stone pain obeys the indifference rule. Arch your back and the agony remains. Sit, stand, kneel. It's still there, pulsing in sync with spasms, not posture. 5. When mild kidney distress masquerades. Not every kidney issue is a medical emergency, but every persistent renal ache deserves professional eyes. Mild hydronephrosis, fluid buildup, early infection, or small non-obstructing stones can simmer for days. You might feel only a vague soreness under one rib, coupled with fatigue. That's when confusion with mechanical pain is greatest. Listen for supporting actors. Fatigue unrelieved by stretching, low-grade fever, icky-smelling urine, or an ache that remains identical all day long. 6. The 24-hour rule of thumb. A simple self-audit many urologists recommend. If flank pain stays identical for 24 hours regardless of movement and pairs with any urinary anomaly or fever, call a doctor. Musculoskeletal pain rarely holds perfectly steady that long. It waxes and wanes with activity, stress, and rest. Kidneys, once inflamed, keep the pressure on. 7. Why waiting can turn dangerous. Untreated pyelonephritis can spread bacteria through the bloodstream, leading to sepsis. An obstructing stone can swell the kidney, damaging delicate nephrons and risking permanent loss of function. Because symptoms often start subtly, a mild ache here, slight nausea there. People underestimate them until the infection roars. Understanding early signals buys you precious time. 8. False friends. When other organs mimic kidney pain. Gallbladder attacks, ulcers, even lower lung pneumonia can masquerade as flank pain. The brain's map of internal real estate is blurry. Visceral nerves overlap, yet the posture indifference and systemic clues still help. Gallstones often spike after fatty meals. Pneumonia adds cough and breathlessness. Ulcers burn with empty stomachs. Combining symptom context with our earlier mechanical pain checklist sharpens a picture. 9 practical take-home diagnostics. Move deliberately. Do cat-camel stretches. Try a gentle forward fold. Arch back over a rolled towel. If pain changes greater than 30%, suspect muscles or joints. Check vitals. A thermometer reveals fever your spine can't cause. Inspect urine. Color, clarity, scent. Your pee is an early crime scene report. Hydrate and reassess. Sometimes loading water flushes tiny crystals and eases discomfort quickly, an outcome rare for herniated discs. Time it. Note start hour. If unchanged overnight, escalate evaluation. 10. Your decision tree. Position sensitive, no fever, better with heat/stretch, like in mechanical. Start conservative care. Position insensitive, urinary changes or fever. Call healthcare provider. Request urinalysis and possibly imaging. Sudden unbearable waves of flank to groin pain, emergency room. Suspect stone. Knowing these distinctions is liberating. Instead of spiraling into fear at every twinge, you possess a diagnostic compass. Muscle knots, facet irritation, and dehydrated discs are painful but fixable with targeted movement and strengthening, topics we cover across this channel. Kidney alarms, while less common, command immediate respect, and now you can recognize them fast. In Part 4, we'll knit everything together. Quick at-home tests, hydration strategies, and a clear plan for when to treat pain yourself and when to head straight for professional care. Confidence replaces panic when knowledge leads the way. Stay with me. Your back and your kidneys will thank you. Part 4, your action plan, home checks, relief tips, and exactly when to see a doctor. You've learned the two voices inside your back pain drama. The chattering mechanical voice that rises and falls with every posture, and the deeper, steadier voice of genuine kidney distress. Knowledge is powerful, but power only matters if you wield it. This final segment arms you with a step-by-step playbook. Simple moves you can do right now, warning signals you must never ignore, and a roadmap for the next 24 hours, 7 days, and beyond. Think of it as a GPS. Green roads for self-care, yellow roads for caution, red road straight to medical help. 1. The 2-minute reality check right now. Stop scrolling, stand up, and do this mini sequence. Place your hands on the painful area and bend forward from the hips. Slowly arch backward, supporting your lower spine with your thumbs. Rotate your torso left and right, as if glancing over each shoulder. Lie on a firm surface and pull both knees toward your chest. Hold 10 seconds. Stand again. Take a deep breath and grade your pain from 0 to 10. If the intensity shifted more than 2 points during any part of that sequence, your discomfort is almost certainly mechanical. Kidneys, even irritated ones, sit unfazed by acrobatics. Mark that score. It's your baseline for strategies ahead. If the pain did not budge, jump to Section 5 and read every word. 2. The 24-hour reset for mechanical pain. Hydrate deeply. Drink half your body weight in ounces of water. Sprinkle with a pinch of sea salt and a squeeze of lemon. Hydration plumps spinal discs and flushes microscopic waste from sore muscles. Imagine wringing out a sponge and then letting it soak in fresh water. Your discs are that sponge. Heat, then move. Apply a warm compress or take a hot shower for 10 minutes to loosen muscle fibers. Follow immediately with gentle cat-camel mobilizations, hip hinge practice, and the knee to chest stretch you just tested. Motion pumps nutrition into joints the way walking pumps fuel into an old-fashioned well. Micro breaks every 30 minutes. Set a silent timer on your phone. When it buzzes, stand, reach arms overhead, squeeze glutes 10 times. Breathe 3 slow belly breaths and sit again. Those 90 seconds prevent discs from drying, facet joints from jamming, and hip flexors from soldering you into a pelvic tilt. Anti-inflammatory nutrition. One meal today should feature salmon or sardines, omega-3s, a heaping cup of leafy greens, magnesium, potassium, and berries or cherries, anthocyanins. Food is chemical information. Feed your spine good data. Sleep in neutral. Tonight, lie on a medium firm mattress. Side sleepers cradle a pillow between knees. Back sleepers place a small cushion under knees. Hips and shoulders should feel level, like wheels on the same axle. 8 hours in poor alignment can undo daytime progress. Rescore your pain tomorrow morning with the 2-minute test. Most people notice a 1 to 3 point drop in 24 hours when they follow the script. If you're among them, continue routine for a full week, adding light core work, bird dogs, side planks, glute bridges, on days 3 through 7. Steady improvement confirms mechanical origin and rewards consistency. 3. The 7-day safety net, cautious monitoring. Pain that trends downward is reassuring, but still deserves watchful eyes. Keep a short daily log. Pain score morning and night, water intake, hours seated, any red flag symptoms. Patterns matter. If your pain plateaus instead of receding or suddenly spikes without new physical stress, lift an eyebrow of suspicion. For the fast-track red flag list, call a professional today. Hold any of these warning lights up against your symptoms. 1 light means schedule a non-urgent checkup. 2 means same-day visit. 3 means urgent care or ER. Persistent pain unchanged by posture for 24 hours. Fever, anything over 100.4 degrees Fahrenheit, 38 degrees Celsius. Visible blood in urine, or urine that is cola-colored, cloudy, or foul-smelling. Severe nausea or vomiting accompanying the flank ache. Sharp, colicky surges radiating toward groin or abdomen. Unexplained chills, night sweats, or fatigue that feels flu-like. New numbness or weakness in legs in combination with back pain could indicate spinal cord or nerve compromise. Remember, kidneys can go from irritated to dangerous faster than most other organs. When in doubt, rule it out. Medical professionals would rather reassure you than meet you later in a crisis. 5. What to expect at the clinic if you hit red. Your provider will ask detailed questions about timing, quality, and triggers of pain. Check vitals, temperature, blood pressure, heart rate. Tap gently over the kidney area, Murphy's punch test, to provoke tenderness. Order a urinalysis looking for leukocytes, nitrites, blood, protein. Possibly run blood work for kidney function, BUN, creatinine, and infection markers, CRP, white cell count. If stones or infection are suspected, schedule imaging, ultrasound, CT, or X-ray. Early treatment. Antibiotics for infection, hydration, and medication for stones. Stops cascading damage. Ignore red flags and you risk sepsis, kidney failure, or irreversible scarring. Your back muscles may hate the gym, but they've never sent anyone to intensive care. 6. The mindset upgrade from fear to mastery. Fear shrinks your world. You sit more, move less, Google symptoms until 3 a.m., catastrophe eyes. Knowledge expands your world. You walk, stretch, hydrate, rest wisely, and sleep better knowing you're monitoring the right signs. Mastery is a habit, not a genetic gift. Each time you run the 2-minute test instead of panicking, you train your brain to favor logic over alarm. Each warm compress plus move session teaches your muscles they are safe to relax. 7. Your 3-sentence mantra. Write it on a sticky note. Set it as a phone lock screen. Repeat it out loud whenever uncertainty creeps in. If movement changes my pain, it's likely mechanical. If fever or urine changes join the pain, kidneys deserve a doctor's eyes. My job is to observe, act, and never catastrophize. If this guide has dialed down your anxiety or illuminated the next right step, tap the like button so YouTube shows it to more people terrified of the same puzzle. Drop a comment telling us which test, posture change, heat pad, hydration, gave you the biggest clue about your pain. And make sure you subscribe with notifications on, because our next video dives into 3 everyday drinks silently dehydrating your spinal discs, and the 2 beverages proven to plump them back up. Your spine and your kidneys are remarkable machines. Treat them with informed respect, and they'll carry and cleanse you for decades to come. Panic steals energy. Knowledge restores it. Keep the checklist close. Stay observant. And remember, the power to protect your body begins with understanding its signals.